speaking of COVID testing, the wastewater, first, from our wastewater data, it's clear that COVID is everywhere. We are seeing levels 10 times higher than at the peak of the Delta wave in August. We know from the wastewater as well that Omicron has virtually replaced Delta and is now the main variant in our community sewage samples. When you look at the areas of the city with the lowest vaccination rates, they also have some of the highest wastewater levels of COVID and the highest number of infected people today. So in the slide with the communities listed, we are concerned that there's probably twice as many people positive that we know of that are testing positive. So right now our city is running 300 positive cases per 100,000 residents. That is about 3%. Doubling that means 6%, or 6 out of every 100 people in a room would test positive. That's 1 of every 15 people that you see today is positive for COVID. And so with that, that is why masks are so important right now. All of us are around COVID on a daily basis. If we are seeing 15 people, 1 of them are likely positive. Vaccines and boosters can provide protection to keep you out of the hospital. Testing lets you know to stay home and away from others, but the mask is what protects you from the 1 in 15 right now that may be infectious and probably out in the community that you could get COVID from. Just to add to this, why masks are so important is that modeling studies both on some of the national sites, so that if we could get our mask use in the community back up to 80% like we had last winter, we could be saving thousands of infections a week. That's thousands of people in Louisville that don't need to get sick, don't need to risk getting long COVID, or even just feeling miserable for a few weeks. Our hospitals are feeling the staffing shortage. This is just another really important reason to wear that mask, get your vaccine, get tested. All that are really important for like the next 2 to 3 weeks as we battle this current surge.